Welcome back to Tech and Titanium. I'm Dexter Maddox, an oral surgeon and the founder of IMvision Dental. We're dedicated to reshaping the future of implant surgery by integrating the most advanced AI, automation, and machine learning technologies into your daily practice. Our goal is simple: to elevate your practice to the next level of profitability while making the experience as stress-free as possible. Today, we have a topic that's certainly gotten a lot of attention in the press lately. And personally, I find it to be incredibly exciting: ChatGPT. There's absolutely a ton of uses for this technology in every industry, and oral surgery is no exception. Here at Tech and Titanium, we'll go through a lot of exciting uses for this technology, from communications to marketing to literature review. Today, we're going to talk about an excellent use case that I've been experimenting with a lot lately: note writing. We'll explore how to use artificial intelligence, large language models, specifically ChatGPT, which was developed by OpenAI, and how that can transform the way we create procedure notes. It's an impressive balance of being thorough, but also being lightning fast. Let's pop over to the computer to check out how it's done. All right, so we're over at the computer and we are now at ChatGPT. To get to ChatGPT, you're just gonna go to chat.openai.com. You can log in. So this is a premium account, which gives you access to ChatGPT 4. I do suspect that it would work just fine with ChatGPT 3.5, which is the free version, and that is actually a little bit faster. ChatGPT 4 is just a little bit smarter, although it is somewhat significantly slower. So feel free to test it out on 3.5. I do, use the premium account a ton, so I think it's certainly worth it. So we're going in and looking at some previous prompts that I've used for it writing my procedure notes over the past few days. And what you'll find is basically I've trained it to take the inputs in a certain way, and that being specifying the procedure type, which is extraction, and then specifying the anesthesia type, which would either be sedation, shorthand SED for SED, for sedation, nitrous, which shorthand for N2O, and then local shorthand LOC. And so it's gonna generate the appropriate note given the anesthesia type. The next thing, you're going to input the diagnosis for these cases. Next is going to be the two sites and then the appropriate modifiers, whether it'll default to simple. If you write surge, it'll be surgical extraction, obviously, STI, soft tissue impacted, PBI, partial bony impacted, and CBI, complete bony impacted. And then you're going to put that into ChatGPT as the prompt, and then it is going to spit out the procedure note, which is super thorough, medical legally super strong, no abbreviations. Everything's described very appropriately, and in putting the appropriate diagnosis, the procedure, and then talking about all of your preoperative steps, that it's going to supplement your anesthesia record, and then putting in the operative note portion of the procedure all appropriately. When you paste this in your note, you can always modify this. I very rarely, if ever, need to do that, but you certainly can. And then it's going to have all the post-operative portion of your note as well as your signature. So it's really quick, an easy way to produce your procedure notes and do it in a way that's super fast. Here's another one: extraction with sedation, all the teeth are impacted, and then the third molars, and you could even say third molars. It can understand third molars are 1, 16, 17, and 32. I didn't teach it that. It just knows that, because it also knows that it's using the universal numbers system, and it has a kind of a level of inference that is why it's such an amazing tool. And then it's going to understand that all sites complete bony impacted, so you don't have to put each and every one of them or CBI. You can start to use kind of natural language, and that's the beauty of these large language models. You can put natural language, it's going to understand that, and then be able to put out the appropriate note. So there's certainly a lot of examples of this for all sorts of procedures, and we can go down here and then start a new prompt to kind of see exactly what it looks like in practice. So let's say we're doing an extraction of, let's say, lower first molars. Extraction with sedation, shift enter, and then we're going to say carries to pulp, shift enter, and then let's say we're taking out 19 surge, 30 surge. So it's going to start, working on this note and writing this note for you, putting in the appropriate diagnosis, putting in the appropriate procedure, putting in all of the preoperative instructions that's going to be appropriate for a sedation, because there's a lot of things you don't need within sedation for, a local or a nitrous procedures, and there's, this and that. So it's going to combine 19 and 30. It's smart enough to do that. So it's not going to be an overly wordy note. I know this is a pretty wordy note already, but unfortunately with kind of the medical legal needs, they kind of have to be, and then put in your signature. So overall, it's pretty fast. You can just copy and paste this whole thing, paste it right into your EMR, and then you're done. You've got a super robust note. So we can jump over to the prompts now to help you understand kind of what I did to teach the language model to do this. If you go up to the top of the thread, you actually see, and I'll link this thread to you so you can read it, but you'll be able to see all the, its responses to everything. And as you go through this, and if you want to put this in on your own, you can make little edits here. Obviously put your name in there or make whatever changes that you feel appropriate. And then from there, it's all natural language. So it's not like you have to know how to code. This is just, talk to the computer. And that's the incredible thing about this technology. So basically I'm saying I would like to teach you how to write procedure notes for dental extraction, then I'm going to abbreviate extraction, assume the universal numbering system. It's going to even pluralize tooth, teeth as appropriate, and kind of so on and so forth. We talked about doing the diagnosis, doing the procedure, talking about using different templates if it's sedation, do a different template if it's nitrous, a different template if it's local anesthesia. Talk about what your different identifiers for your different extraction types are, and then you can actually have it kind of default to certain things. So have it, default for partial bony extraction for third molars, and then you can have it default for, instead of it doing a simple extraction, you have it default to do a surgical extraction. I've given it some examples here of what the appropriate outputs are. That's everything it needs to then be able to start, writing your notes. So that's the gist of it. There you have it. You have your own personal scribe through ChatGPT. Please see the description where I have the prompt that you can make some minor edits for yourself to suit your own style, and then copy and paste that into ChatGPT just like we showed. Please don't hesitate to reach out if you have any questions or if you just like to collaborate on your solutions. From here, my plan is to refine the prompt and include more of our common procedure types, including implants and expose and bond procedures. I'm close to a solution here, so keep your eyes out for a follow-up video. If you've enjoyed this video and found it to be helpful, then please give me a like, a comment, and subscribe to the channel. It really helps me with the YouTube algorithm. Then our fellow colleagues can use this content to hopefully make their lives a little bit better. Thanks for watching all the way to the end. This is Dexter Maddox with IMvision Dental. I'll see you next time.